You and your friends are out to dinner. You all notice a woman who has hair on her chin, a dark ring around her neck, and she's overweight. Your friends laugh and crack jokes, but you sit back in your chair and wonder what's wrong. A possible answer is PCOS. PCOS is abbreviated for polycystic ovarian syndrome. I started experiencing symptoms of PCOS when I hit puberty at 12 years old. I suspected I had PCOS when I was 19. However, I couldn't get a doctor to diagnose me until I was 24. According to womenshealth.gov, between 1 in 10 and 1 in 20 women are affected by PCOS, averaging about 5 million women in the United States alone. PCOS is also very common in the United Kingdom and Europe. Today I will explain to you what PCOS is, how it is diagnosed, and how it can be treated. First, I'll explain to you what PCOS is and how it affects your body. PCOS stands for Polycystic Ovarian Syndrome. Defined by WebMD, PCOS is a problem which a woman's hormones are out of balance. It can cause problems with the menstrual cycle and make it difficult to conceive. Here is the difference between a normal ovary and a PCOS ovary. The normal ovary is smaller. It's clear of cyst. The PCOS is enlarged, and the little blue sacs that you see are the cyst. What happens with the PCOS is every month when a woman starts her cycle, she grows follicles. Inside the follicle is an egg, and the hormones that her body makes causes the eggs to mature. When they mature, the follicle releases the egg, and this is known as ovulation. With polycystic ovaries, with their hormones being out of balance, this causes the follicle not to release the egg, and instead the follicle stays in the ovary, it seals itself, and then creates a cyst. PCOS may cause serious health problems, such as diabetes and heart disease. There's also studies saying that hypothyroidism and PCOS are connected. It can also cause high cholesterol. Typically with hormones, one hormone releases signals that then releases another hormone. With PCOS, the sex hormones get out of balance. The ovaries are supposed to make small amounts of androgens, which is male hormones such as testosterone. With PCOS, they make more than they are supposed to. This causes the woman to stop ovulating, get acne, and grow extra facial hair. Next, I will talk to you about how PCOS is diagnosed. According to the Mayo Clinic website, there is no specific test to diagnose PCOS. In fact, a recent article on NBCnews.com states that experts are contemplating changing the name of PCOS because the current name is confusing. Since having cysts on the ovaries isn't a requirement, many women have the disease but do not know it because the doctors misdiagnose them, the patient because of the current name. PCOS is diagnosed by a combination of medical history, a list of symptoms, blood work, an ultrasound, and/or a pelvic exam. Symptoms can include, but don't have to include, missed menstrual period, infertility, high sugar levels, high cholesterol, acne, facial and excess body hair. No two women that have PCOS will have the exact same symptoms. Finally, I will tell you how PCOS is treated. One of the most common problems with PCOS is insulin resistance. This is treated by a diabetic drug, metformin, along with a combination of a low-carb diet. Eating too many carbs raises sugar levels, which raises insulin, which the body doesn't know how to use, called insulin resistance, so it gets stored as fat, most commonly around the waist. There's a drug by the name of spironolactone. This is used to treat the hair growth, the male pattern baldness that she may have. Also the high androgen levels. The trick with it is it can't be used if the woman's trying to get pregnant or if she is pregnant because it causes severe birth defects. So most doctors will give spironolactone along with a birth control pill. And they keep up with the blood work to see if she's actually taking the birth control pill, and if she's not, then they won't write a prescription for the spironolactone. Another problem with PCOS is fertility. Treating fertility is very tricky, or infertility is very tricky. Most doctors start out with Clomid or a combination of Clomid and metformin. After about 6 rounds of Clomid, if the woman still is not pregnant, then they will try the IUI, which is insemination. If that doesn't work, then they try the injections with the Clomid. Then, if none of that works, then they'll move on to IVF, which is in vitro fertilization. Today I have explained to you what PCOS is, how it is diagnosed, and what treatment options are available. PCOS can be very hard on a woman and her husband if they are trying to get pregnant. There is no cure for PCOS, however you can manage the symptoms with the right combination of medicines. Managing PCOS can be very frustrating at times. At times you may feel like you just want to give up. My advice to you is don't. Instead, find a doctor who understands PCOS, has time to listen to your concerns and frustrations. In my case, I am lucky enough to have 3 very good doctors who work together and understand my condition. One is my primary, the second is my endocrinologist, and the third is my reproductive endocrinologist.